Hello and welcome to Brazil. Before we embark on our journey, I'd like to talk about an important aspect of health we should keep in mind during our stay here: malaria. Malaria is a disease transmitted by mosquitoes infected with the Plasmodium parasite. It is common in some tropical and subtropical areas around the world, including Brazil. Malaria symptoms include fever, chills, headache, nausea, and fatigue. In severe cases, it can lead to serious complications and even death. To prevent malaria, it's important to use mosquito repellents containing DEET, especially during dawn and dusk when malaria-transmitting mosquitoes are most active. Additionally, wearing long-sleeved shirts and long pants can reduce skin exposure to mosquitoes. Sleeping under insecticide-treated mosquito nets at night is also crucial in preventing mosquito bites. In some high-risk areas, the use of anti-malarial drugs as prophylaxis may be recommended. It's essential to consult a healthcare professional for specific guidance on the need and type of medication. If possible, it's best to avoid areas known to have high malaria rates. By taking simple preventive measures such as using mosquito repellent, wearing protective clothing, and sleeping under mosquito nets, you can significantly reduce the risk of contracting malaria during your stay in Brazil. Always remember to prioritize your health and well-being while enjoying all the wonders this country has to offer. A crucial aspect we haven't touched on yet is the treatment of malaria. If you suspect you have contracted malaria, it's important to seek medical attention immediately. Malaria is a serious illness, but it's treatable when diagnosed early. Medical professionals typically prescribe anti-malarial drugs for treatment. These drugs work by attacking the malaria parasite in your body. It's important to note that the type of drugs and length of treatment may vary depending on the type of malaria parasite you have, the severity of your symptoms, your overall health, and other factors. One key point to remember is the importance of completing the full course of treatment. Even if you feel better, you must take all the prescribed medication. This ensures that all parasites are eliminated from your body, preventing relapse and reducing the risk of drug resistance. In conclusion, early diagnosis and treatment can help prevent complications and even death from malaria. So stay vigilant and remember, your health should always be your top priority. Continuing from our discussion of treatment, let's now shift our focus towards preventive measures, specifically the malaria vaccine. Yes, you heard it right, there's a vaccine for malaria known as RTSS or Mosquirix. This is a crucial development in our fight against this deadly disease. The RTSS vaccine was created to protect against P. falciparum, the most deadly malaria parasite globally, and the most prevalent in Africa, where malaria takes its heaviest toll. This vaccine works by training the immune system to attack the malaria parasite, which is spread by mosquito bites. The primary series of the RTSS vaccination consists of 4 injections. The first 3 doses are given at 1-month intervals, followed by the 4th dose 18 months later. After these 4 doses, the vaccine has been shown to prevent approximately 4 in 10 malaria cases, including 3 in 10 cases of life-threatening severe malaria. However, it's important to note that while this vaccine represents a significant step forward, it's not 100% effective. The vaccine's effectiveness decreases over time, and it doesn't protect against all types of malaria. Therefore, it's essential to continue using other preventive measures, like bed nets and insecticides, even if you or your child has received the vaccine. In conclusion, while the RTSS vaccine isn't a silver bullet, it's a valuable tool in our arsenal against malaria. Coupled with existing preventive measures, it significantly reduces the risk of severe malaria. So, stay informed, take preventive measures, and get vaccinated if you're in an area where the vaccine is available. Moving on from our global perspective on malaria, let's zoom in on a specific country where malaria is a significant public health concern: Brazil. Most of the malaria cases in Brazil are concentrated in the Amazon region, where the Anopheles mosquito, the primary vector of malaria, thrives in the dense tropical forests. The Brazilian government has been making concerted efforts to control malaria. These include distribution of long-lasting insecticide-treated nets, indoor residual spraying, and providing free diagnosis and treatment in health facilities. The country has also introduced the malaria vaccine in high-risk areas as part of their comprehensive approach to combating the disease. The efforts have paid off to a certain extent. According to the World Health Organization, Brazil has seen a dramatic reduction in malaria cases and deaths in recent years. However, the fight is far from over. Challenges persist, including the vast geographical area, the mobility of the population, and the presence of hard-to-reach indigenous communities. Moreover, there's the threat of drug-resistant malaria. In the Amazon region, where the majority of Brazil's malaria cases occur, P. falciparum has shown resistance to multiple anti-malarial drugs, making treatment more difficult and underscoring the importance of preventive measures. In conclusion, despite the challenges, Brazil has made significant strides in its battle against malaria. The fight continues, and with continued efforts and global cooperation, we can hope to see a malaria-free Brazil in the future. Remember, malaria is preventable and treatable. So, stay informed and do your part in the fight against this deadly disease. In this video, we've explored various aspects of malaria, a disease that continues to pose a serious threat in many parts of the world. It's important to remember, though, that malaria is preventable and treatable. Prevention methods include using insecticide-treated nets, indoor residual spraying, and taking anti-malarial drugs. If you're planning to travel to an area where malaria is prevalent, such as the Amazon region in Brazil, it's crucial to take these precautions to protect yourself. Education and awareness are also key in the fight against malaria. Know the symptoms, fever, chills, and flu-like illness, and seek medical help immediately if you suspect you have the disease. Early diagnosis and treatment can save lives. If you're a traveller, remember to be responsible. Don't put yourself and others at risk. Always check the malaria risk in the areas you're planning to visit and take the necessary precautions. In conclusion, even with the challenges that malaria presents, with the right knowledge and precautions, you can enjoy your travels while staying healthy. Malaria is a battle that we can win. So stay informed, stay safe, and do your part in the fight against this deadly disease. Thank you for joining us in this exploration of malaria. We hope you found it informative and helpful. Until next time, safe travels.